Hello, I'm going to talk about parvovirus, also known as Fifth's disease. The incidence of pregnant women getting parvovirus is 1 to 3%, and the prevalence of having had parvovirus goes up with age. So under the age of 5, it's about 2 to 10%. By the time you hit 20, 40 to 60% of adults have been exposed to and are immune to parvovirus, and it keeps on going up with age. The route of transmission is typically airborne during the winter and spring months when we're all inside and breathing the same air. However, it can also be spread in a hand-to-mouth and airborne route. Typically, these outbreaks occur in schools and daycare centers. If a woman is not already immune to parvovirus and their kid has been exposed at daycare or school, and now they're living together, and may ask what their chances of getting parvovirus are, it is 50%. So the risks involved in a mother contracting parvovirus include spontaneous abortion, stillbirth, fetal loss, and fetal hydrops. Typically, it's related to aplastic anemia, but can also be associated with myocarditis and fetal hepatitis. So in terms of patient presentation, they are going to complain typically of just general viral symptoms, so fever, malaise, headache, some joint pain is also common with parvovirus. Objectively, you're going to see possibly an elevated temperature, the classic slapped cheek rash on their cheeks, which can also extend to more of a lacy rash on their trunk. Anemia is seen typically only in patients with pre-existing hematologic conditions, and then you're also going to see some seroconversion with a positive IgG or IgM based off of their exposure status. And in very rare cases, you might see encephalitis, so altered mental status. Some other things you're going to want to rule out include rubella, measles, group A strep, acute rheumatic arthritis, and transient aplastic crisis. While routine screening for parvovirus is not recommended, if you do suspect your patient of having it, you're going to want to draw a CBC, check their titers if you don't already know their immunologic status, check an ANA, a throat swab for strep, the parvovirus antibodies, and then you can also check for fetal infection with a parvovirus DNA from amniotic fluid, although the qualitative PCR is more common and more specific. So in terms of treatment, there's no specific treatment for mothers. A lot of it is just going to be supportive care for something you would typically recommend for any kind of viral infection during pregnancy. So that's essentially going to be Tylenol, hydration, and rest. But in terms of fetal surveillance and monitoring, you're going to want to do serial ultrasounds, typically every 1 to 2 weeks for 8 to 12 weeks after exposure. You're going to assess for ascites, placentomegaly, cardiomegaly, hydrops, fetalis, and impaired fetal growth. And you're also going to do the Doppler of the middle cerebral artery to assess for fetal anemia. If need be, the fetal blood transfusion is life-saving in these cases.